Hello, this is Dr. Jerry Morris, and I'm here to talk to you about our Policy and Procedures section for prevention and reporting of critical incidents. Now, it's required by CARF and by the state that we review these each year. So during this program, I will give you an introduction, and then you will have the ability to click on another section which has our written policies and procedures. You should review them thoroughly, and then you should click on the section that is the exam for this section. Your instructions are to follow this process to the point that you can complete the exam with a 70% or above score, and then you will print out your exam page and take it and turn it into human resources to go into your. Now, CMHC staff, upon hire and annually, will receive training in the health and safety practices of the company in our policies and procedures. You will notice that during periods of violence or insecurity, we consider any threats of assault towards staff or patients a serious matter to be reported to the police for public action. Patients are told this as a part of their admission, consent for treatment, and packets, and they are told that we have a zero tolerance policy for violence or threats to others. This includes sexual violence or sexual threats. It's our policy also that staff will always be screening for contraband, weapons, illicit drugs, or things that might be a danger to either a patient or others in the program or staff. It is our policy that any staff that is threatened, witnesses threats or assault, file a complaint with the police department. This is part of their job duties. In filling such complaints out, the patient's confidentiality will be respected, and a description of the incident will be given, but no information that the person is a patient, about their diagnosis and treatment, or other private information will be given except a critique of the incident unless we are ordered by law. All incident reports relating to these activities will be filled out in written form and placed in the patient's file and filed with the clinical director or the assistant clinical director's office by the staff involved, period. Senior staff are responsible to make the determination to contact the clinical director when there is time in regard to harm or danger to others, and get the clinical director's review and approval for the action of calling the police. If the clinical director is not available, then the assistant clinical director will be the person who will be contacted. We always have a clinical director or assistant clinical director on call, and they can be reached at any time. Now, the staff should note that we want to do this whole program of prevention and reporting of critical incidents with an overarching view of human rights and respect and sensitivity. We want to provide an environment that is safe and where there is no tolerance for the kind of things that might harm a patient. But on the other hand, we are responsible also to the patient to teach them that they cannot use violence or threats of violence to. It would not be therapeutic to do otherwise. Now, remedial actions in these policies and procedures are described in writing. When there's a critical incident resulting in harm to a patient, to staff, or to the public, the clinical director and assistant clinical director must be immediately contacted for disposition, decision, and remedial action. Remedial action options are: first, immediately call 911 and access first responder emergency services for the person. 2, get appropriate clinical staff to assess the person and make a recommendation to the clinical director or an assistant clinical director. 3, call the police and stabilize the violent situation and inform the clinical director or designee. 4, seclusion or restraint are never used at CMHC Inc. So if someone tries to elope during this process, the staff are and simply allow the police or authorities to intervene to apprehend them. 5, clinical de-escalation and crisis intervention techniques, including such things as reassurance, redirection, separating parties, calling for assistance with other staff to stabilize situations, and such are used where possible. Now, the whole program is designed to establish respect, sensitivity, and safety for all involved. This means clinical staff, families, patients, or those in the community. Now, in your policies and procedures, you will see written guidelines on medication. We do not dispense medications, but we check in medications and we observe medications. When medications are dispensed, they're dispensed by our physician and nursing staff in accordance with law and through an outside formulary. When it becomes apparent that an individual has been exposed or contracted disease at CMHC that could have been prevented, this constitutes an incident and triggers procedures for critical incident analysis and filing of critical incident report. If a biohazard or an incident occurs, such as toxin spill, contact with the patient, this will affect the procedures pertinent to the incident report, removing all patients from the area, quarantining the area, and taking appropriate measures to contact clinical director and authorities. Biohazards. Wandering is not considered a critical incident at CMHC unless it results in injury, such as wandering into the parking lot and being hit by a car. That would, of course, be a critical incident. Wandering is considered a clinical issue and affects clinical and team interventions and is not an incident report requiring activity. Weapons are not allowed to be possessed by patients, and we have procedures for this. And if during the day treatment such patient is found with a weapon, but no one is injured or threatened, this is not defined as requiring a critical incident report, but is considered a clinical issue for supervision, withdrawal of the weapon, confiscation of the weapon, and activities to remediate, such as determined by the team leader and the patient's team. Now, elopement is not considered meritorious of a critical incident report, but again is handled as a clinical issue. A suicide attempt is a critical incident and triggers the incident report procedures. Any sexual assault is defined as inappropriate touching of genitals or breasts or attempts to kiss, hold for sexual purposes, or threats of doing so are considered sexual assaults and trigger critical incident reports. I hope that this helps you with a starting orientation to our policies and procedures on critical incidents. If you will now close this section out, and just adjacent to it is a section on our written policies and procedures. Spend some time reviewing them and then close them out and click on the area just adjacent to that to take your 10. You must pass the 10-item exam with 70% or above in order to turn this into your personnel file as completion of your required training annually. If you do not pass, then you will be asked to go through this module again and learn these procedures until you can pass the exam. Thank you very much.